Alright guys, this is Ty the Asian Wonder again, your online personal trainer. In this video tutorial, I want to show you guys how to rehab your knee after knee surgery, or orthoscopic surgery, or after knee replacement surgery. Right? There's several ways you can do it, and I want you guys to keep in mind something. The rehab that I show you is completely different from how your physical therapist would show you. And here's the reason why. When you go to a physical therapist, their job is to rehab your knee so it's back to normal. To right here. So if this was your normal knee strength right here, they would bring it back to normal right here. Their goal is not to get it so it's above average. Now, there's several things that could have happened. You could have had a sports injury, or your knee can just be outright weak to begin with. Whatever the reason is, your knee needs to be stronger after surgery than it was before the surgery, where it was just average strength. So the rehab exercises that I show you are more strength exercises, strength and conditioning exercises, much more so than the rehab exercises. So the first thing you need to do after knee replacement surgery or orthoscopic surgery, any one of those, any kind of cutting on your knee, is that you want as quickly as possible to start movement in your knee. By that, I mean that when your knee is cut open by the surgeon, the surgeons, right, the orthopedic surgeon, what happens is your body creates what's called a lat T-swirl, or a scaffolding, across the area that's been cut, your tendons, your ligaments, your muscles, everything like that, and it crisscrosses like that, like the scaffolding outside of the tall building that they're getting ready to build, right? So what you need to do is you got to create as much movement in your knee as possible, and without the sharp pain in it, so you can break up that lat T-swirl and that scaffolding and scar tissue around your knee so that blood can circulate through it. Because the faster that blood can circulate through it, the more that the blood can transfer proteins and nutrients into that damaged area and repair that area. So after the knee surgery, the first exercise I need you to do is this, right? Let's just say that my left knee is the one that got the surgery. I want you to do is, when you sit on a bench like this, right, I want you to try as much as possible to just bend your legs as much as you can. And you want to do this like 3 times a day, maybe in the morning, after breakfast, after lunch, and after dinner, right? What you want to do is like maybe 20 to 30 reps where you try to bend it as much as you can. Now obviously you just had the knee replacement surgery, the surgery, so you're not going to be able to bend it 100%, right? But do your best as much as you can. And what you're doing is you're trying to get blood flow to come in there, and you're trying to break up that scar tissue that's built inside the knee, which you don't see, but you can feel it, right? So you can do that as much as possible. Now, if you have money and you're going to physical therapy, or you have insurance and you have physical therapy, obviously they're going to strap you to a machine and it's going to bend your knee for you. And you want to set that, you want to do that machine as much as your insurance will pay you, because that's one of the fastest things to get motion back into your knee, right? So now, if you can get that, then you don't have to do the manual bending on your knee. Now, obviously, if you can afford the knee surgery to begin with, your insurance will probably cover the rehab afterwards. And that's about as good as it gets for the rehab guys, is for them to use that machine, which you're not going to find in a regular public gym, to bend and straighten, you get that motion back in your knee and straighten and stretch that ligament, right? So if you can get that part done, either at home by creating motion in your knee 2 to 3 times a day, or go to the rehab and let them do it on the machine for you, the next step after that, after you create motion in your knee, is to start the strengthening process. And the strengthening process, in which I show you, is a lot more effective than the one that they show you at the physical therapy, and gets you results a lot faster and stronger. So let me move the camera back and I'll show you guys what you need, all right?